improve the quality of life of women with autism. Thank you all so much for coming today. My name is Fiorella Hernandez. Together with my colleagues, we will talk about how nutrition can improve the quality of life of women with uterine fibroids. First of all, I will start with the definition of uterine fibroids. Uterine fibroids or fibroids are benign tumors that can arise from the small muscle cells of the uterus in 25% is women of childbearing age. Most women have no symptoms, but the other part of them have symptoms that fall into three categories, which are irregular uterine bleeding, pelvic pain, and infertility. The bleeding that characterizes uterine fibroid is menorrhagia, or also called hypermenorrhea, which is an excessively prolonged menstruation. One way to know if these fibroids are present is by palpation of the enlarged and abnormal contour of the uterus by pelvic examination. The epidemiology of uterine fibroids responds to gonadal steroids, which are estrogens and progesterone, present in the woman age range of 30 to 40 years, and sometimes is rare in adolescents. No cases have been found in girls. Other factors that influence the development of fibroids is the type of rise of the pattern. Black women have the highest incidence of uterine myxomatosis. The pathophysiology is not yet well defined. However, it has been found to be a combination of genetic predisposition, steroid hormone levels, and growth factors important to the fibrotic process and angiogenesis. There are two processes that lead to the generation of fibroids. Number one, transformation of normal myocytes into abnormal myocytes, and number two, growth and clinical appearance tumors. Diagnosis. Diagnosis is usually based on the finding of an enlarged mobile uterus with irregular contours on two-handed examination or an incidental finding and ultrasound examination. Imaging techniques are useful when the diagnosis needs to be confirmed or when fibroids need to be located before surgery. So, more on the subject will not be explained.
Talking about diagnosis, transvaginal ultrasound is highly sensitive, from 95 to 100% for detecting uterine fibroids in less than 10 weeks. This is like the most widely used method due to its availability and cost and effectiveness. MRI can provide a better information about the region of fibroids. If imaging studies cannot provide an accurate diagnosis, a surgical exploration is sometimes necessary. Talking about risk factor, we have age and palliative. The risk of myomatosis increases with early menarche. Postmenopausal women decrease from 70 to 90% fibroids apparition. On premenopausal women, the risk decreases to 20 to 50%, and the more children they have had, it is much lower. If we talk about ethnicity, there are more common in women of black race, in which it is found between 3 or 9 times more frequently than the ones with white race. Additionally, they have a rhythm of faster growth. Oral contraceptive use, they seem to not have a definite relationship, but in some studies there are an inverse relationship between oral contraceptives and the risk of developing uterine myomatosis. Talking about hormone replacement therapy, for most women with uterine fibroids, hormone therapy does not stimulate uterine growth. If the uterus grows, this is more related to the progesterone dose. Women with pre-existing fibroids do not have fibroid regress as would be expected in menopause, and occasionally these fibroids can grow. If we talk about weight, obesity increases the conversion of adrenal androgens to estrogen, and decrease sex hormone binding globulin. Therefore, than in women with a body mass index greater than 30, this risk is greater. If we talk about the diet, there's a little evidence of the association with diet, but it has been reported in the literature that the red meat and ham can increase the incidence while green vegetables decrease it. And for those women who has, if we talk about exercise, for those women who are athletes, have 40 less risks compared to sedentary women. The reason for this difference is not really clear yet, and it is because of exercise or the low conversion rates of androgens and estrogens due to BMI. If we talk about family history, the first degree relative of parent with myomatosis has 2.5 times higher risk of uterine myomatosis than those who have no family history. Pregnancy has one of the most risk factors involved because it has been suggested that the high levels of sex steroids associated with pregnancies commonly cause growth of uterine fibroids, as well as their symptoms. In fact, the fibroids share certain characteristics of the normal myometrium during pregnancy, such as increases extracellular matrix production and increased expression of receptors for peptides and steroid hormones. They are present in 1.1 to 8.6% of pregnancies.
So I'm going to talk about treatment. Asymptomatic uterine fibroids are managed independently. Treatment will depend on the site of the fibroid, its location, symptoms, age, and also reproductive and obstetric history. The objective of medical therapy is to alleviate symptoms. The therapy should be taken as the first line of treatment. So we have medication. Medication for uterine fibroids are target hormones that regulate your menstrual cycle. Treatment symptoms such as heavy menstrual bleeding and pelvic pressure. They don't eliminate fibroids, but may shrink them. So medication includes gonadotropin release hormone, or also known as GnRH agonist, which treats fibroids by blocking the production of estrogen and progesterone, putting you into a temporary menopause-like state. As a result, menstruation stops, fibroid shrinks, and the anemia often improves. We have also progestin release intrauterine device, also called IUD. Progestin releasing IUD can relieve heavy bleeding caused by fibroids. A progestin releasing IUD provides symptoms relief only and doesn't shrink fibroids or make them disappear. It also prevents pregnancy. And by the other hand, we have tranexamic acid. This non-hormonal medication is taken to easy heavy menstrual periods. It's taken only on heavy bleeding days. So we also have non-invasive procedures. This non-invasive treatment option for uterine fibroids that preserve your uterus requires no incisions and is done on an outpatient basis. We have performed while you're inside an MRI scanner, equipped with a high-energy ultrasound transducer for treatment. These images give your doctor the precise location of the uterine fibroids. When the location of the fibroid is targeted, the ultrasound transduce focuses soundwaves, sonications into the fibroids to hit and destroy small areas of fibroid tissues. And also we have neurotechnology, so researchers are learning more about the long-term safety and effectiveness, but also for data collect shows that FUS for uterine fibroids is safe and effective. We also have minimally invasive procedures using artery embolization. So these small particles, embolic agents, are injected into the artery supplying to the uterus, cutting off blood flow to fibroids, causing them to shrink and die. We also have radiofrequency ablations. In this procedure, radiofrequency energy destroys the uterine fibroids and shrinks the blood vessels that fleets them. This can be done during a laparoscopic or transcervical procedure. A similar procedure called cryomyolysis freezes the fibroids. We have laparoscopic or robotic myomectomy, hysterectomic myomectomy, and also endometrial ablation. And then we have the traditional surgical procedures, which are abdominal myomectomy. If you have multiple fibroids, very large fibroids or very deep fibroids, your doctor may use an open abdominal surgical procedure to remove the fibroids. And also an hysterectomy. This surgery is a removal of the uterus, remain the only proven permanent solution for uterine fibroids. But hysterectomy is a major surgery. So we also have suggested diets. If you're trying to manage your fibroids and maintain or shrink their current size, then balancing your hormones naturally is a good first step. Your diet has a great influence on your hormone levels, which is why it is one of the first and easiest areas to apply change. For the best tips in controlling fibroids, try to limit the following foods and beverages in your diet. We have high-fat processed meat. As we all know, red processed meat contains a lot of added hormones, especially estrogen. High-fat dairy products, traditionally dairy products, may contain a high level of steroids, hormones, or other chemicals that promote inflation. We have high salt foods. High salt foods are bad for the liver. Also, the liver is the most responsible organ for removing toxins and balancing hormones. We also have refined carbohydrates, soybeans, which contains phytoestrogens. These compounds act like estrogen in your body. This may help you if you are fighting low estrogen levels, but they are a challenge for fibroids. That's because high estrogen levels seem to promote the growth of fibroids. Also, we have refined sugar. High intake for sugar can cause inflammation and weight gain. There is a correlation between weight and gains and hormone imbalance. We also have caffeine. Well, too much caffeine can put extra stress on your liver and prevent the organ from working the way it should. And also alcohol. Excessive drinking can cause inflammation of your body and reduce immune function. Reduce or abstaining from alcohol can help promote healthy balance of your hormones. So thank you.